Hello and welcome to the next day class from your very own Nepali nurse educator. Today we are here to learn one of the most important topic in Nclex and the one that nurses think is difficult but in reality it is not. First of all, it is very important to know what Nclex asks in EKG, okay? Electrocardiogram. So for Nclex, I have kept here 5-step EKG prediction method made easy for you. This video is more focused on exam based for all the Nclex aspirants. Hope you all like the video, and if you want to learn, please watch the whole video, okay? So let's start. If you follow this system, trust me, you don't have to guess again. So let's start from heart rate. Count the number of QRS complex in 6 seconds and multiply by 10, okay? This is how you get the heart rate. And if you are confused about the QRS complex, we have the next idea. Use the big box method. Here you have to measure the distance between two R. Count the number of boxes between one R to next R. And for this, you have to remember if the distance is just one box, the heart rate will be 300. Two box 150, 300, 475, 560 and 650. For example, if there are 4 big boxes from one R to next R, then the heart rate will be 75 beats per minute. So what are the difference between these two methods? The QRS complex method is best for irregular rhythms. It is the easiest one, okay? The box method is most suitable for regular rhythms. This one is more accurate than 6-second method. So as we all know, the normal heart rate is 60 to 100 beats per minute, and if it is below 60, we tell it bradycardia, whereas if it is above 100, it is tachycardia. Always know if the patient is too fast or too slow with the heart. Find out whether it's an medical emergency or not. One gold memory line for you is count the weight, know the rate, and guide the action. Make sure you practice with some of the EKG strips. Now let's move to the next topic, rhythm. As we all know, rhythm is how regularly the heart beats. Finds out how even is the every heartbeat. How to check rhythm? Here also we can look at the rhythm by RR interval. Find out the space between one R wave to next R wave. If the spacing is regular, then the rhythm is regular. If the spacing is unequal, then we will find out the rhythm is irregular. Compare one RR distance with the next RR distance. So let's talk about the types of rhythm. First one, regular rhythm. They have equal spacing and are easily predictable. For example, normal sinus rhythm, sinus bradycardia and sinus tachycardia. Next we have irregular rhythm. In irregular rhythm, we have unequal spacing and is unpredictable. And most important, Nclex type is irregularly irregular. What is irregularly irregular? It is arterial fibrillation, or we can tell AFib. What it means? Completely no pattern at all, and a complete random spacing from one R to next R. Why is it happening? Means arteria is not contracting properly. Electrical activity is very chaotic. Let me give you a clue for this. If you see any ECG strip with irregular rhythm and no P wave, it is arterial fibrillation. In Nclex, you says irregularly irregular and no pattern. Always remember AFib. And a memory line for you here is rhythm follows pattern. No pattern is AFib or arterial fibrillation. Now let's move to the one of the important part, P waves. What is P wave? P wave is arterial contraction or atria depolarization. It shows how the electrical signals started in the SA node. SA node or normal pacemaker. So simple way to think, if you see a good P wave, normal one, think that atria is working properly. So how to check a P wave? Ask two questions. Is there a P wave? If yes, then no problem with atria, it is working properly. No, there is a problem with atria. Next one, is there one P wave for every QRS? If yes, it is normal conduction. If no, then abnormal rhythm. In normal findings, we will always see one P wave before every QRS and similar in shape. Most common, as we talked about in rhythm, no P wave and irregular rhythm is atrial fibrillation. If there is extra or white P wave, again it's atrial problem. What are they? They are atrial flutter and atrial tachycardia. Here what you have to remember is one P wave always before every QRS and similar in shape. No P wave, atrial problem. No P wave and irregular rhythm, atrial fibrillation. Abnormal P wave might be atrial flutter and atrial tachycardia, but remember it is always atrial if there is problem in P wave. Okay, now let's move to the next part, which is PR interval. What is PR interval? It is time taken by the conduction to travel from the atria through AV node to ventricle. It starts from P wave and end at beginning of QRS as shown in the picture. So simple way to think is PR waves is pause before ventricle contraction. Normal is about 3 to 5 small box in ECG paper, which is 0.1 to 0.20 seconds. If PR interval is longer than 0.20 seconds, it is considered abnormal. This means AV node is slow and it might be first degree AV block. Now let's move to QRS complex. It is ventricular contraction or ventricular depolarization. This is actual heartbeat you feel. Normal value is less than 3 small boxes, which is less than 0.12 seconds. Normal QRS is always narrow and sharp. Normal QRS is more than 3 boxes and wide. Normal QRS means there is a problem with the ventricle. For example, ventricular tachycardia and bundle branch block. Why does the QRS get elongated? Because electrical signals is not using the normal pathway. There is no organized QRS plus chaotic rhythm. Think about ventricular fibrillation or VFib. It is one of the life-threatening conditions and may require defibrillation. VFib means emergency. So, whenever you see a ECG, find out if the rate is too fast or slow, if the rhythm has a pattern, regular or irregularly irregular. Is the QRS complex narrow or wide? Wide QRS complex is danger. Okay, this was for today. Hope you understand. If you have any questions, please let me know in the comment section below. Thank you everyone for watching. Happy studying, and in the next part we will study all of these things together and find out what is the